Novant Health is a not-for-profit, integrated healthcare system. Based in Winston Salem, North Carolina, Novant serves more than 5 million people in North Carolina, South Carolina, and Virginia. In 2005, Novant participated in a study to examine adverse drug events leading to hospital admissions. The study found that patients 65 and older are twice as likely to be treated in an emergency room for an adverse drug event and 7 times more likely to require hospitalization. These results led to the development of the SafeMed program. SafeMed targets patients over the age of 65 who are discharged from a Novant facility and followed by a Novant primary care physician.
It's a fantastic program because what it's meant to do is capture patients that leave the hospital on multiple medications or patients that are at risk of having medication problems and have them directly linked to a pharmacist.
SafeMed uses clinical pharmacists to provide patient education about medication safety, reconcile the medication regimen, identify potential complications of therapy, and provide the primary care physician with a complete list of each patient's medications.
When I see a patient that's been in the hospital and discharged on multiple medications, they always have been linked with the SafeMed pharmacist. So I have a sheet in my hand that shows exactly what medicines they're taking, and I feel 100% confident that the patient understands that they're taking those medicines and that they have the prescription and they're taking them correctly. So we're starting on a page where we're all understanding the medicines from day one.
Yeah, Mr. Smith, my name is Becky Bean. I'm a pharmacist and I work with Novant Medical Group.
Once the pharmacist reviews the discharge medication list, the patients are called to provide a targeted intervention.
By having a pharmacist call the patient as soon as they get out of the hospital, we give them a connection between the hospitalization and their primary care physician. We go over all the medications in the hospital that they were on in the hospital, try to make sure they understand, and they have a contact person for in the future.
We will contact patients once they're back in their home setting. That way they can have all of the medication vials at their fingertips where we can literally run through each medication and know how they're taking the medication, how many tablets, what the dosage is, what time of day.
In addition, each patient is mailed a personalized medication list, educational materials, and a pill box to help them manage their medications.
They seem to care about me as a person, not take me as a unit like some people do. The attention to me was personal, and that was what really impressed me in the very beginning with SafeMed.
The entire SafeMed population was matched to a control group, and the results were impressive. 30-day readmission rates for the SafeMed group were lowered from 13.1% to 6%, and 60-day readmissions were lowered from 7.7% to 2.7%.
The program is wildly successful, as in my opinion. We've been able to decrease rehospitalizations related to adverse drug events by about 14%, which is huge. And that really translates to better use of dollars in the healthcare system. But more than that, it translates to better quality of life for patients and a better understanding of their disease.
It's definitely rewarding, especially when you have a patient tell you that you've helped them prevent some type of side effect. It's rewarding when you can make a recommendation to a physician that could save the patient $100 a month. It's rewarding when you can reassure a patient that they're taking the medication the way they're supposed to, or let them know a better way to take the medication, because that's going to give them more confidence that they're more in control of their health.
The SafeMed program is an outstanding example of how the principles of quality improvement can be applied to dramatically improve patient outcomes. The APHA Foundation is proud to honor Novant Health with a 2009 Pinnacle Award.